Did you know that your blood type can be a ticking time bomb for your heart? Certain types are more fragile and have a higher risk of serious heart problems. Worse still, there are warning signs that many ignore until the worst happens. In this video, you'll find out if you carry this hidden risk and what the signs are that can anticipate a tragedy. This could be the chance to avoid a fatal problem. Don't ignore the signals your heart is giving you. Did you know that heart disease is the world's leading killer? Seriously. But calm down, because I'm going to explain everything in an easy way and in 3 parts. In the first part, I'm going to show you 7 signs that you can notice in your body and that are warning signs of heart health. This way, you'll know what to look for to identify if something isn't right. In the second part, we'll talk about the 7 classic symptoms, those sensations you can feel when your heart isn't working properly. It may be that you, a family member or a friend have already felt something like this. And to round things off, I'll give you some valuable tips on how to prevent heart problems in the future. This video is going to be super comprehensive, so stay until the end. I'm sure you'll learn something new. Before we start, please like the video, because the more people who do this, the more YouTube will show this content to those who don't have easy access to doctors or hospitals. And don't forget to share it with friends and family. Your help could save lives. Do you have a heart condition, or think you might? Leave a comment here telling us where you're from. Now let's go. What are the 7 signs that could indicate a heart problem? I bet that after seeing the 7th one, you'll take a closer look at people's ears. Did you know that even the ear can be a sign that the heart is in trouble? It sounds strange, but it's true. Back in the 1970s, Dr. Sanders Frank, a well-known physician, noticed that many of his patients who had chest pains, the famous angina, had a curious sign, a diagonal line in the ear. He called it Frank's sign. Now you might be thinking, what does the ear have to do with the heart? The answer is not so simple, but one idea is that the same problems that damage the heart's arteries can cause this fold to appear in the ear. It's like an external sign of something going on inside. But calm down, not everyone who has this line in their ear has a heart problem. If we take 100 people with this sign, about 30 of them have nothing wrong. It's just a sign of aging. However, if the person is younger, say around 40, and already has this mark, it's worth paying closer attention. In someone in their 80s, for example, it could just be the effect of time. Still, even if you don't have this line, it doesn't mean you're totally free of heart problems. Only 40 out of every 100 people who have blockages in their arteries have this fold, so its absence doesn't guarantee that everything is 100%. Another sign that can indicate circulation problems is the loss of hair on the legs, especially the shins and then the thighs. When the blood doesn't circulate properly in the legs, the hairs can start to fall out, and this is called peripheral arterial disease, which is the clogging of the arteries in the legs. This is important because when the arteries in the legs are blocked, it's common for other areas of the body to also have circulation problems. Imagine that the legs can also give clues as to the health of the heart. When blood can't circulate well in the legs, this can indicate that other parts of the body, including the heart itself, may have problems with the arteries. This blockage is caused by the buildup of fatty plaques on the artery walls. Many people who have this problem in their legs, called peripheral arterial disease, don't even realize it until it is well advanced. One of the clues that this is happening is the loss of hair on the legs, especially on the shins and thighs. Why? Well, in order to grow, hair needs nutrients that come through the blood. If the arteries are clogged, not enough blood gets there, so the hair can stop growing and even fall out. In addition, the skin on the shins can become smoother, shinier and even cooler to the touch, and the nails can grow more slowly. But it's worth remembering that hair loss on the legs can have other causes, such as genetics or even friction with pants. Another interesting sign to look out for is something called xanthelasma. Have you ever noticed that some people have a yellow spot near their eyes, usually on the upper eyelid? This is xanthelasma, which are deposits of cholesterol in the skin. It doesn't hurt and is usually just a cosmetic issue, growing slowly. This sign is more common in middle-aged women and usually appears near the corner of the eye. Although xanthelasma is just a mark, it can be a warning. Around half of people with this yellow spot also have high cholesterol or high triglycerides. Curiously, only 1% of people with high cholesterol develop xanthelasma, but when it appears, it can mean an increased risk of serious problems such as heart disease, heart attacks and even strokes. So, if you have xanthelasma, It's a good idea to have your blood tested to check your cholesterol levels and take care of your health. Come on, imagine that some signs in the body can indicate that it's time to pay attention to the heart. Here are a few more of them. Fourth sign, senile arc or corneal arc. Have you ever seen someone with a whitish or grayish line around the iris, which is the colored part of the eye? This is called senile arc or corneal arc. It is caused by the accumulation of cholesterol around the edges of the cornea. This line appears mainly in older people and is super common. More than half of people over 60 have this arc, and after the age of 80, almost everyone develops it. And there's no need to worry, as it doesn't affect vision or require treatment. But there is an important detail. When this arch appears in younger people under 45, it can be a sign of very high cholesterol, which increases the risk of heart disease. So if you're young and have noticed this arch, it's worth checking your cholesterol and triglyceride levels with your doctor. Third sign, cyanosis. Cyanosis is when the skin turns bluish or purple in some areas, and this can happen when you're cold, which is normal. But if you notice this bluish color on your skin even when you're warm, it could mean that that part of your body isn't getting enough oxygen. Oxygenated blood is very red, but when it lacks oxygen, it becomes darker, tending towards purple or blue. If, in addition to this coloration, the person is short of breath, this could indicate something serious, such as heart or lung problems. Some conditions that can cause this include pneumonia, pulmonary embolism, or even heart failure, when the heart can't pump blood properly. So, did you already know this sign? Did you know it was an important warning sign for the heart? Let me know in the comments if you've experienced something like this or know someone who has. I'll reply and help you there. Second sign, non-healing wounds on the legs or feet. You know those wounds or bruises on your leg or foot that take a long time to heal? Well, that could be a sign that the blood isn't circulating properly there. When the arteries are blocked, the blood doesn't reach them properly and the wounds take a long time to close. Those who suffer from this usually feel tired, sore legs, and sometimes even cramps when they walk a bit more. These sores, called arterial ulcers, usually appear on the outside of the legs, on the heels or toes, and generally don't bleed. Venous ulcers, on the other hand, usually bleed and are more common in those with varicose veins or vein problems. Unlike arterial ulcers, these appear when the blood in the veins can't get back to the heart properly. First sign, swelling in the legs, ankles, and feet. If your legs, ankles, and feet are swollen, it could be a sign that the heart is having difficulty pumping blood properly. The body begins to retain fluid, which causes the swelling to appear. Sometimes you notice that your shoe feels tight or that your ankle feels fluffy, like bread dough rising. And if you squeeze this area, you may even get a little mark, like a hole. This swelling is usually more visible at the end of the day, because gravity causes the fluid to flow down the legs. A tip: if you raise your legs when you lie down, the swelling tends to go down. First symptom, shortness of breath. Now for the first symptom to watch out for, shortness of breath or dyspnea. This means that when you exert yourself, you feel out of breath. Let's talk about some of the symptoms that the body gives off and which may indicate that the heart isn't working properly. I'll explain everything very simply. You know when you're doing something light, but it feels like you've run a marathon? You're out of breath, even with little effort. This could be a sign that your heart is having trouble pumping blood throughout your body. Second symptom, persistent cough with white or pink phlegm. A cough that won't go away, especially if it has white or pink phlegm, can be a warning sign. This pinkish phlegm indicates that there is fluid in the lungs, which can happen when the heart isn't working properly. If you notice this cough, see a doctor. Third symptom, shortness of breath when lying down. If, when you lie down, you feel short of breath and start using more pillows to sleep better, or even have to sleep sitting up, you should pay attention. This symptom is known as paroxysmal nocturnal dyspnea and can be a clear sign of a heart problem. Fourth symptom, weakness and general tiredness. When even simple tasks such as climbing stairs, carrying bags, walking, or even combing your hair seem too heavy, it could be because your heart isn't pumping enough blood to your whole body. Did you already know this sign? Did it surprise you? Let me know in the comments if you've noticed anything like this in yourself or someone close to you. I'm curious to know, and I'll help you with more information. Fifth symptom, waking up several times to urinate, nocturia. If you wake up several times during the night to go to the bathroom, this could be a sign that your heart is overloaded. When the heart isn't working properly, the body begins to retain fluids during the day, and at night, when you go to bed, the body tries to eliminate this excess. Sixth symptom, leg pain when walking. This is called intermittent claudication. When you walk for a while and start to feel pain in your calf, it could be that the blood isn't circulating properly in your legs. These signals are the body's way of asking for attention. If you feel any of them, it's worth talking to a doctor about taking care of your heart. Seventh symptom, chest pain. When you feel chest pain, the first thing you should think about is a possible heart problem. It's no use thinking it's just muscle pain, gas, or something simple. It could be, but it's always best to get it checked out. Chest pain caused by heart problems can last a few minutes, come and go, and feel like pressure, tightness, heaviness, or burning. It can radiate to the left arm, neck, back, chin, stomach, or even the elbows. Accompanying this pain may be a cold sweat, paleness, nausea, or dizziness. If you feel anything like this, it's time to see a doctor immediately. Now, let's talk about how to take care of your heart to avoid these problems. Prevention tips for a healthy heart. 1. Get moving. Getting off the couch and exercising is one of the best things you can do for your heart and body. Light activities such as walking, cycling, or swimming improve circulation and help keep veins and arteries healthy. 2. Quit smoking. Smoking is one of the heart's biggest enemies. It inflames the arteries, forms fatty plaques, and increases the risk of heart attacks, strokes, and even dementia. If you smoke, quitting will help your health too much. 3. Maintain your ideal weight. Being overweight can raise blood pressure, worsen blood sugar control, and put a strain on your heart, kidneys, and joints. Let's look at some more practical tips for looking after your heart and health, shall we? I'll explain them in a very easy way. Eat well. Eating well is essential. Include fruit, vegetables, fiber, whole grains, and olive oil in your diet. Avoid too much red meat and processed foods, which are rich in bad fats. Keep an eye on your family history. If you have close relatives, such as a father, mother, or siblings, who have had heart problems such as heart attacks, strokes, or heart surgery, you should be even more vigilant. This could mean that you need more tests to monitor your heart health. Take care of your cholesterol. To keep your cholesterol under control, avoid bad fats, such as trans fats and saturated fats, and increase your intake of fiber and oats. Remember, 80% of cholesterol is produced by the liver. So even if you do everything right, your body may need a little extra help with medication, and that's okay. Control your blood sugar. If you have diabetes or prediabetes, it's essential to keep your glucose levels under control. Glycated hemoglobin, which shows the average sugar levels over the last 3 months, should be below 7%. Monitor blood pressure. The ideal blood pressure is below 12/8. If your blood pressure is always high, it's a good idea to check with your doctor, as controlling blood pressure helps prevent heart problems. Seek medical help at the slightest sign. If you notice any of the signs we've mentioned, such as chest pain, shortness of breath, excessive tiredness, or swelling in the legs, don't wait. Go to the doctor and explain what you're feeling. Do you know your blood type? Many people don't know their blood type. But this is important because, depending on your type, you may be more likely to have certain health problems. These are some tips for taking care of your heart and living well. Let's talk about blood types and what they can tell us about health, in a very simple and interesting way. Did you know that blood type can influence certain diseases? There are different types of blood, and each type has special characteristics. Some blood types, for example, may be associated with higher risks of certain diseases. Do you know your blood type? I hope it's not the most dangerous type. In this video, I'll tell you about blood types and the health conditions that can be linked to them. Stay until the end, because this is a very important subject for your health. Why does everyone have a different blood type? Our blood type is determined by the presence or absence of substances called antigens. Think of antigens as identifiers on our blood cells. The immune system recognizes these identifiers, and if they are familiar, it lets the cell pass. But if it doesn't, our body will attack it, thinking it's an invader. There are 2 main blood classification systems. Most people are familiar with the ABO system and the Rh factor. In the ABO system, we can have antigens called A and B in our cells. If you have the A antigen, you are type A. If you have B, you are type B. If you have both, you are type AB, and if you have neither, you are type O. The Rh factor is like an extra protein. If you have this protein, your blood type is positive, plus symbol, and if you don't, it's negative, minus symbol. These two systems combined result in the following blood groups: A+, A-, B+, B-, O+, O-, AB+, and AB-. Curiosity about blood type. The most common blood type in the world is O+, followed by A+. The rarest is AB-. Why is it important to know your blood type? Knowing your blood type is essential in emergency situations, such as accidents involving blood loss or major surgery, because a blood transfusion saves lives. In a transfusion, we need to receive blood of the right type to avoid serious reactions. So, as well as helping to save lives, knowing your blood type can help you take better care of your health. Why do we need blood transfusions? Blood is a very important thing, and sometimes people need to receive blood from others in order to get better. This can happen to babies who are born prematurely, people with cancer, pregnant women who have lost a lot of blood, or people who have diseases such as severe anemia. There are many reasons for needing a transfusion. Different blood types. Each person has a blood type, such as O, A, B, or AB. Some blood types are rarer, such as O negative and AB negative. O negative is special because it can be given to anyone, regardless of their blood type. It is the so-called universal donor, and is often used in emergencies. For this reason, it is always in short supply in blood banks. However, those with O negative can only receive the same type. How does our body deal with someone else's blood? Our immune system creates antibodies to defend itself. These antibodies attack anything our body doesn't recognize. So if a person with B blood is given a blood, their body could reject the blood, which could be very dangerous. That's why it's very important to give the right blood type to each person. How do we know our blood type? Our blood type comes from our parents. They pass on a part of each of the genes that make up our blood type. For example, if the parents have B blood, it's more likely that the children will be B or O. But if a different type appears, such as A, it could be that there was a mistake, such as an exchange in the maternity ward. What about rare blood types? In addition to the best-known types, there are another 600 types of antigens that make up super rare blood types. Some are so rare that only 1 in 6 million people have them. This is called golden blood or Rh null. It is so rare that fewer than 50 people in the world have this type, including some people in Brazil. What is golden blood? There is a very rare blood type called golden blood or Rh null. Those who have this blood don't have any of the Rh system antigens in their red cells, which is what makes it so rare. These red cells tend to be more fragile, and those with Rh null can only receive blood from other people with the same type, which makes it difficult to find donors. How do you know your blood type? To find out your blood type, an ordinary blood test, such as a CBC, is not enough, as it only shows red and white cells and platelets. If you don't know your blood type, you can check old tests or take a specific test. Another way is to donate blood. As well as finding out your type, you're helping other people, as each donation can save up to 4 lives. Foods to keep you healthy. Some people believe that certain foods are more helpful depending on your blood type. For example, some say that people of one blood type should avoid certain foods while others should eat more of them. There are even natural programs and recipes that promise to help keep our organs healthy with herbs and plants that we can grow at home. Want to know more? Follow these tips and take good care of your body. The blood type diet. Where does it come from? This idea of eating according to blood type came from a book in the 1990s called The Blood Type Diet, which became very famous. The author said that people's blood type came from their ancestors and that, therefore, each blood type had foods that were better for health. For example, type O came from hunters, so should eat more proteins, such as meat and fish, similar to the paleo diet. Type A came from farmers, so should avoid red meat and eat more vegetables, a more vegetarian diet. Type B, called nomads, they can eat plants and meat, but should avoid chicken and pork and consume some dairy products. Type AB, called the enigma, would be a mixture of types A and B with a varied diet. The diet also told everyone to avoid processed foods. Maybe that's why some people felt better on this diet, by avoiding these processed foods. Does the science back this up? Larger studies done later found no evidence that the blood type diet actually works to improve health. In 2013, a major review of studies showed that there is no proof that eating according to blood type brings specific benefits. Personality and blood type. Is there a link? In Japan, there is a belief that blood type influences personality, like signs. People with type A are said to be kinder and more demanding, while those with type B are optimistic and independent. But a study has shown that there is no link between blood type and personality. What about health? As far as illnesses are concerned, there is some connection. A Harvard study showed that people with type O have a lower risk of heart disease, while type AB has the highest risk. But, as a cardiologist would say, we shouldn't blame blood type for health problems. It's much more important to take good care of your diet, exercise, and maintain healthy habits. Health care. What's most important? Look, our blood type can have some influence on our health, but what really makes a difference is taking good care of our bodies. It's important to keep an eye on blood pressure, blood sugar levels, glucose, cholesterol, and lifestyle in general. For example, those with type O seem to have a lower risk of having a stroke, which is great, but on the other hand, they may have a higher risk of ulcers and skin cancer. Type A has a higher chance of developing stomach cancer, and this may have something to do with the fact that people with this blood type tend to have higher levels of cortisol, the stress hormone. But the most important thing is what we can change. The truth is that you can't change your blood type, but you can improve the way you live. How about exercising, avoiding habits such as smoking, reducing stress, sleeping well, and enjoying life? All this helps to keep your body healthy. Did you like these tips? If so, give them a like, subscribe to the channel, and activate the bell to receive more health tips. And share this information with those you love. Taking care of your health is always good to share with others. Now, choose the next video you're going to watch, and we'll see you next time. Stay healthy and see you there.